tea is bad. Nutmeg is a stimulant, can make you crazy. Cinnamon is a stimulant. Vanilla is an opiate. Plants do all this kind of stuff. Well, you can have an inflamed thyroid and not know it.
Many people take curcumin and turmeric.
Oh my God.
Dr. Elizabeth Bright is an osteopath and naturopath, and the best-selling author of Good Fat is Good for Women.
She has helped thousands of people fix their health, and it starts with a high-fat carnivore diet.
Bipolar disorder is associated with hypothyroidism. Schizophrenia is associated with hyperthyroidism. Your heart function, your liver function. It's very odd. I have people coming to me with the strangest diagnoses that they were told. Somebody with migraines was told that she was born with a malformed carotid artery. No, she wasn't. You throw a dart, everything you hit is going to be thyroid.
What are your thoughts about broccoli?
It will prevent the absorption of iodine. But so are flax seeds, soy, so are yams, so is oatmeal. But don't ever delude yourself into thinking that that's nutrition. Meat doesn't do it. Animal products don't do it, but so many plants do it. Why is your thyroid not functioning properly? It needs iodine, it needs zinc, it needs iron, it needs all these nutrients that we get on a carnivore diet. So I'd start there. If you're eating so much protein that it doesn't turn into muscle tissue and enzymes, it's going to turn into glucose. Fat will never turn into glucose.
I want to talk about the fat. What is the ratio that you would recommend, macros?
Well, I don't love the question because everybody's different. So women need more fat than men.
Should every single person take iodine?
Yes.
And how much should people take?
I take 6 every day.
This episode features Dr. Elizabeth Bright, and she'll teach you the #1 way to fix your thyroid with what you eat. Now, by the end of the episode, if you still have a question or you need help, you can meet Dr. Bright live on our Go Carnivore community. You can ask any of your questions to her, as well as our other carnivore doctors. Just head to gocarnivore.com. Now, if you're learning from and enjoying these free episodes, please hit the subscribe button, because we know that food is medicine. And by the simple act of subscribing, you can help share this message to millions more people that need to hear it. And now for the episode with Dr. Elizabeth Bright. Dr. Bright, welcome.
Hi, Rena. Nice to see you again.
Now, you are an osteopath and a naturopath, and you have thousands of patients that come to you from all across the world with a wide variety of problems. It could be things like brain fog, inability to lose weight, hair loss, or extreme fatigue. And all of these issues come from one big problem in the body. That problem is your thyroid. So in this episode, Dr. Bright is going to share her decades of research and experience and talk about the thyroid, the 10 common symptoms that you need to know, and most importantly, why some things like tea, cheese, and dairy are destroying your thyroid. So Dr. Bright, my first question. If someone has just clicked on this video and they're thinking, do I have a thyroid issue? How likely is it that somebody has an issue with their thyroid?
Well, it's very likely these days for a couple of reasons, which is why I wrote my second book, Good Fat is Good for Girls, Puberty and Adolescence. 150 years ago, goiter was usually in mountainous areas like Bolivia or Switzerland, and that was because there was very little iodine in those places. Unfortunately, in our modern world, we have so many substances that interfere with the absorption of iodine, tea being one of them, that it is now an epidemic. So the reason why you could say that thyroid is the conductor of the hormone orchestra, what you read and people often say, is because after an egg is fertilized in a woman's body, if she becomes pregnant, the first thing that develops is the thyroid gland. So as you know, the fetus, there's the endoderm and ectoderm tissue, and all these tissues form after the formation of the thyroid. So the thyroid is connected to all these organs and tissues function.
So you said it's highly likely. So I'm thinking, if someone's watching this, men or women, how likely is it, for example, for a woman that they have a thyroid problem?
Traditionally, it's been more likely in women. More and more men are coming to me with hypothyroidism, and more younger, even children are coming to me with inflamed thyroids. So the thing about people assume, and many doctors assume, they tick off these boxes that they're taught. Overweight, as you said, hair loss, cold hands, but not. You can those symptoms don't necessarily have to present themselves. Now, the reason why women have traditionally been more, so 80% of all hypothyroid cases were women, right? So you could just look that up and statistically, is because, which is why I wrote the book, Good Fat is Good for Girls. Sexual characteristics need a lot of thyroid hormone and iodine for their formation. So women, girls, form more sexual characteristic. There's more tissue involved. The uterus gets bigger. The breasts get bigger. The ovaries get bigger. There's less tissue that needs so much thyroid hormone during puberty. So that is really what I've seen over the years, what I've come to, and that's why I wrote the book. That's when it's happening.
Okay, I want to also talk about male issues as well and thyroid issues pertaining to men. When patients come to you, because as I said, they fly from all around the world, and you're doing virtual consultations as well now. How many of your patients are men, and how many of your patients are women?
I don't count because people get better and I don't see them anymore. So I would say 5 to 10%. So not a lot of the percentage.
So majority are going to be in women, but it could also affect men as well, right?
Absolutely, absolutely, because we're all in the same environment. And as I said, Bolivia, Switzerland, the mountainous area, Tennessee, where my family's from, there were goiter belts. You know, you go on Google and you look up goiter belts. The goiter belts have expanded. Iodine insufficiency is everywhere because of pollution, because of the foods we're now eating, because of PFAs, because of those, all our garbage is flying, is, like being sent to Indonesia and they're burning, all this stuff is happening that our air, people who didn't, the world is much smaller and it's very interconnected. So all the crap from the modern world is being pushed over to everywhere. And that's unfortunately why it's become so commonplace.
Absolutely. I want to talk more about iodine a bit later because people are so fascinated about iodine. And then you have people saying, it's not good for you, it's great for you, what should I do, and how much I should have. So we're going to talk about that a bit later. But I want to talk more about thyroid conditions because there are conditions that we hear of like low thyroid, so hypothyroidism, or an overactive thyroid, hyperthyroidism. Is that such a thing?
Well, yes, in the sense that the thyroid is overproducing. But why is it overproducing? Instead of giving somebody what they figured out, they actually isolated methimazole from a farmer who saw that all his rabbits had goiter because they were eating cabbage leaves. So they isolated this chemical from brassica, which is why broccoli's bad and cabbage bad and kale is bad, and because those things, that substance that are in these vegetables, interfere with the absorption of iodine. So the thyroid gets bigger. Goiter is basically an inflamed thyroid. So it can either, in young people, it'll overproduce. It's like trying really hard to make hormones because it's essential to life. So this poor thyroid is being beaten on by inflammation, and it's like a hamster in a treadmill going really, really fast, and then usually it just crashes. But unfortunately, you can have symptoms like palpitations, high resting heart rate. You can have the eyes go forward because of the liquid that accumulates behind the eyes in both hyper and hypo. Liquid accumulates everywhere, like the hyaluronic acid that people are injecting in themselves, and the fillers and stuff made out of the same stuff. So that's why it's all inflamed thyroid function. It's all low thyroid function due to the absence of iodine, the absence of certain nutrients, which is why I always recommend high-fat carnivore diet. So that's, really why I don't, the conditions hypo and hyper, you can't separate them, just like you can't separate adrenal function from thyroid function.
Let's talk more about that a bit later, adrenal function and thyroid function. Okay.
And there are articles of all this stuff on my website.
It's all connected. That's why it's so important. Like your hormones, your thyroid, adrenals, everything is all connected. So if somebody has a problem, it's not just coming from one issue. And also, quite interestingly, a lot of thyroid issues, it's not pertaining to the thyroid itself. It's outside issues or outside things affecting the thyroid. Is that correct?
Yeah.
So people can think, like, for example, my thyroid, there's a problem with my thyroid. It's the thyroid, but it's other things causing that, which we're going to talk about. I want to talk about something else, which is a huge epidemic, Hashimoto's. I feel like every single person that we see in the carnivore communities and in my private community, they're like, I have Hashimoto's. That's why when you're a guest speaker, there is so many people on there saying, I have a thyroid issue. I have Hashimoto's. Can you explain what is Hashimoto's and why that would happen in the first place?
All right, Hashimoto is the name of a guy, a surgeon in the 1920s, I think, who took out, or no, 1914, I don't remember exactly, it's in my book, who was cutting out, surgeons in those days like to cut out goiters, all women, and they didn't know how to fix it. I remember surgeons were, as I said in my book, the cowboys of medicine, right? So I remember that show, The Nick, where, they were like trying so many people died during surgery. So many women died during surgery. It wasn't always the best solution, but he recognized in the goiters that he removed from these women, only four, that the lymph tissue in the thyroid was engorged. It was swollen, as opposed to the more documented goiters thyroids that they had removed, where the whole gland was swollen, or it was the follicular tissue, because the follicles are what make the thyroid hormone. They didn't even name it after him until the 40s, and he didn't isolate the antibodies. So then in the 40s, they isolated two antibodies, antithyroid peroxidase and antithyroglobulin, which are components, enzymes that the thyroid needs to have in place to form hormones. The problem is that they stopped looking for antibodies. So I can have somebody who has the same symptoms of Hashimoto's but doesn't have positive antibodies. The other problem is that they're usually only looking for antithyroid peroxidase, because statistically, that is the one that is more often positive, and they don't even look for antithyroglobulin. Although I have so many lab reports come in, I can't remember which country, which state in the U.S., right? Because this is all over the world. Some of them say at the bottom, you must test both antibodies to come to a correct conclusion, but not everybody. So there are people who even ask their doctors, please test both of these. And they say, yeah. And then they just test one. And why are there more? Because there's more inflammation, Rena.
Okay, so the Hashimoto's, it's an autoimmune condition where your immune system is attacking the thyroid. Is that right?
Exactly. And your immune system is part of the stress response. So the stress response is your immune system. So you can have inflammation. You can have all of this happen to you. Your immune system, as I often say, goes rogue because it's trying too hard. Asthma is autoimmune. Diabetes is autoimmune. There are all these things that are autoimmune because they're not functioning properly, because your immune system is attacking those tissues. And usually it's because the immune system is overactive. It's hyperactive. It's overprotective.
Okay, just a question around, is anything like Hashimoto's, an autoimmune condition, something that we cannot control or something that is genetic of any means or any source?
No,
Okay, I think that's so important for people to hear.
absolutely, because everybody's into genetics. My next article going on my site is going to be thyroid and genetics, because thyroid has huge influence on your DNA.
So the thyroid has a huge influence on your DNA?
Mhm.
How?
Because, first of all, the mother's thyroid hormone is turning on all those ticks, all those genetic boxes while the fetus is in the womb. There's hardly any, so the baby's basically built on the mother's thyroid hormone. And that's when all these conditions sort of become predisposed. Your genes are dependent upon thyroid function. Your thyroid function decides which genes prevail.
Let's talk about another autoimmune condition, Graves' disease. Do you see a lot of patients with Graves' disease?
Yes, but that is simply another antibody that they discovered, which usually is symptomatic of the overproduction of thyroid hormone.
And why would that happen in somebody? Is again the overactive stimulation of the immune system?
Yes, there are antibodies that will start attacking thyroid tissue. So inflammation will make your immune system start attacking thyroid tissue. What bothers me is that they're all coming from the same place, as you said, the immune system. So usually people with Graves are given methimazole or given, or the thyroid, or many of my patients have had their thyroid nuked. They radiate it and zap it, and then they are definitely hypothyroid because they kill the thyroid. So yeah, it's a hyperthyroid associated, but still comes back to the same thing. It is actually an inflamed thyroid causing both the autoimmune response and the symptoms.
If it comes to hypothyroidism, hyperthyroidism, autoimmune conditions, do they all have the same solution to fix it?
Yeah.
Okay, we're going to talk about that solution. But before I do that, I want to ask you about you, Dr. Bright, because you are quite unconventional in your approach to this solution to fix all thyroid disorders. I guess so many different doctors, they try to prescribe a drug or different things, and patients don't get better. As we've seen so many people coming onto our community, and then they say, my doctor gave me this medication, Synthroid, et cetera, and then they don't get better. How did you get so interested in the thyroid? Because you are an expert in the thyroid, and then with hormones and also the adrenals.
Because I went back to school and I made a connection between my mom, who was diagnosed late. And my mom, when I was a kid, was often depressed. And my mom had periods of being overweight, had periods of yo-yo dieting, and then she was just emaciated. And right around the time they diagnosed her, in her 50s, I was like, I don't know, 18. And I remember this little white pill she took. She took levothyroxine. But before that, when I went back to school, I learned that that low thyroid function causes carpal tunnel syndrome and tarsal tunnel syndrome. And I remember when my mom, I was 11, had tarsal tunnel surgery, and it was the most horrible and painful experience she'd ever had. And this really affected me. And I was just putting all this stuff, and she's from Tennessee. So I was putting all this stuff together, and all these lights were going off. And I said, wow, my aunt didn't get out of bed for a year. She wrote a book. And my grandma was always, kind of mean to my aunt because she would say, oh, she doesn't clean the house. She doesn't take care of the kids, because she was just lying. She had no energy. And so all these things kind of congealed in my head. Wow. And so I just followed that path and did a lot of research, and it blew my mind.
Absolutely. And we're going to talk about some things that people say to fix your thyroid, but you're totally against it. But prior to that, I want to ask you about the thyroid, because I think people might not understand, first of all, where is the thyroid
Here,
and what does it do in the body?
everything. And it's very much, you've heard of the vagus nerve, right? Which starts at C2 and goes into the vagus nerve is called the wanderer, the wandering nerve, right? Because it goes so far, it goes into the heart, it goes into the stomach, goes into the intestines, and so many things. Oh, I have vagal nerve issues. And if the thyroid is inflamed, it basically touches the vagus nerve. So as an osteopath, I was like, wow, you can, because as osteopaths, we're taught vagal nerve, do certain manipulations to, certain things in the cervical spine to adjust, issues that could be caused by the vagus nerve being inflamed. And boom, yeah, the thyroid's going to inflame the vagus nerve if it's enlarged or inflamed.
And then why is the vagus nerve important for the whole body?
Because it crosses so many tissues, heart, stomach, intestines. It's so neck, people have migraines. It's just travels and impacts so many tissues. It's just one little part of this big story, But we're talking about the placement of the organ, Rena. So it's so close to the vagus nerve that it's just an example of how it can affect so many tissues just by its location.
And you mentioned that the thyroid affects everything. So this is why when patients come to you with so many different problems, that can be the reason why it comes down to the thyroid. So can you explain what the thyroid controls, like very high level, very basic things so that people can understand?
The brain, how much energy, metabolism. So how much T3 your brain has will affect your mood. Bipolar disorder is associated with hypothyroidism. Schizophrenia is associated with hyperthyroidism. Your heart function, your liver function, high liver enzymes is associated with fatty liver is associated with hypothyroidism. So it's, you throw a dart and everything you hit is going to be thyroid. It's very odd. I have people coming to me with the strangest diagnoses that they were told. Somebody with migraines was told that she was born with a malformed carotid artery. No, she wasn't. And I have all these strange things because basically doctors like, I don't know. I don't know why you have migraines, and here's this medication. Why? Why do I have migraines? Why have I had migraines since I was a teenager? Because your carotid artery is malformed. So people stop looking. They feel miserable and they have to go on these medications. I have a very systematic and in-depth way of looking at people's history of, pictures, history, medical history, certain things that are so common that I've seen in so many different people. If you come to me and you have endometriosis, it's an iodine and thyroid issue. If you've had miscarriages, it's an iodine and thyroid issue. So that's why I say it affects everything.
As Dr. Bright mentions, the thyroid affects so many different aspects of our health. And later in the episode, Dr. Bright will talk about her protocol to fix the thyroid, and it starts with a high fat diet. But I want to highlight that what you eat is just one part to fix your thyroid and your overall health. Red light therapy is also really, really important. Now, what red light therapy does is that it penetrates several millimeters into the tissues and it helps with enhancing energy production. It's going to help with increasing blood flow. It reduces oxidative stress and inflammation, and it also helps your body's repair processes. So, what does this mean for you? That means better recovery, improved sleep, even improved skin health. Now, you can do this very naturally. You can go out into the sunlight, especially between the hours of 10 a.m. and 2 p.m. But many people don't have access to natural sunlight, maybe because of your work schedules or maybe where you live. So that's why investing in a red light therapy device might be beneficial. And that's why I have BondCharge as a sponsor of today's video. BondCharge produces high quality red light therapy devices with bioactive frequencies of red and near infrared light at 660 nanometers to 850 nanometers. Now, BondCharge has so many different red light therapy devices to suit your budget, but I like this mini red light therapy device from BondCharge because it's quite compact and portable. And if you're super keen on optimizing your health, you also need to think about blue light. Now, I'm sure many of you spend a decent amount of time in front of your TV and especially in front of your phone. Well, these devices emit what's called blue light. And over time, blue light can actually suppress your melatonin production, which can affect your sleep. So you might want to try some blue blocking glasses. I like these ones from BondCharge. These are the Morris blue blocking glasses that block 100% of blue and green light. I just pop these on a few hours before sleep, and I find I have a better night's sleep. So if you'd like to try BondCharge's red light therapy devices or their blue blocking glasses, just head to bondcharge.com/Primal Podcast and use code PRIMAL15 to get 15% off. I want to talk about common symptoms because people might think, well, do I have a thyroid issue? Most likely you actually do. But if you know these common symptoms, you will know that, oh, I need to fix my thyroid and I'm experiencing this because perhaps it's a thyroid issue. Can we go through some common symptoms? I have the first one here. Unexplained weight changes. Many people will say, I am gaining weight. So, can you explain how a thyroid imbalance can make people gain weight?
Metabolism. You're not metabolizing anything if you have a thyroid issue.
What does that mean?
Well, you're not, for instance, your triglycerides will be high and your cholesterol levels will be abnormally high because what you eat is just sitting there. It's not turning into energy. It's not turning into tissue. It's just sitting there. It's not being metabolized. It's not being synthesized.
Okay. And then the opposite problem, if somebody is losing too much weight, is that also a thyroid issue?
It could be a thyroid issue if your thyroid is overproducing. It could also be an adrenal issue, though, because we know that you can have an Addisonian presentation. You can have reactive hypoglycemia if you have an adrenal issue, which means your insulin response to food, usually carbohydrates and only protein, if you're only eating protein and not fat, your insulin response will be too strong and poof, everything you ate just goes away and you have hypoglycemia. So you can have that and not be able to gain weight.
That's why you're an advocate for high fat carnivore, emphasis on the high fat. Let's talk about the high cholesterol levels. So you mentioned that that's a reason why somebody can have high triglycerides. I have a lot of people that say, I have high triglycerides doing carnivore. Why is that happening? Could be their thyroid.
Yes, absolutely. One of the older ways of diagnosing hypothyroidism before they isolated the hormones themselves was just cholesterol. Person had high cholesterol, the thyroidologist, which nobody even, Google doesn't even have that word anymore. The thyroidologist would say, well, you have a thyroid issue. Putting together, obviously, the high cholesterol with all the symptoms.
So high cholesterol, high triglycerides, high LDL as well?
Absolutely. That's what high cholesterol is the stupid LDL, HDL crap, which I don't go for. But yeah, I just look at the total and yeah, that's why. And then oh my God, take a statin, you've got high LDL. Because it's just sitting there. HDL is when it comes back to the liver, when it's been used and synthesized and turned into brain tissue and hormones and all this good stuff. So
Okay, we're going to talk more about cholesterol and thyroid function. What about heart rate? So, if somebody's experiencing a slower heart rate or a really fast heart rate, why is that a sign of a thyroid issue?
bradycardia and tachycardia. So you have, in the article, thyroid and heart function. You have the heart is given a rhythm. It's not the organ that has an issue in most cases, although people are put on hypertension medication, beta blockers, etc. Some even have surgery. The adrenergic stimulation comes from the adrenals, but it's T3, thyroid hormone, the active thyroid hormone. It regulates this stimulation. So the heart's rhythm is given to it by thyroid hormone. So you can have both, which is why it's very confusing to people. You can have both the low heart rate, that is, you have low blood pressure, low pulse with hypothyroidism, right? Because you can actually lie down though and hear your heart beating hard, but slow. But then you can have the fast because usually that's associated with the inflamed thyroid.
Let's get to the next one, memory issues or brain fog. I think brain fog is a big one.
It is. Yeah. Remember, the brain doesn't get the energy it needs if you're hypothyroid.
And why is that?
Because T3 is what makes the brain go.
And what is T3?
Thyroid hormone, 3 iodine molecules. It's the active thyroid hormone. Unfortunately, you can't measure brain levels of thyroid hormone. And TSH does not talk to the brain. So when you're measuring TSH, article explaining that on my website, when you measure TSH, you're not measuring the function of your brain that is affected by low thyroid function. It won't be only certain tissues in the body use TSH to communicate, which is a pituitary hormone. It's not even a thyroid hormone. Use TSH to communicate with the thyroid and say, I want more. Only a few tissues.
Does that mean that if somebody has low thyroid, that can cause dementia or Alzheimer's because it affects the brain?
And Parkinson's, yes. And yes, and mental health issues and children born with autism and learning disabilities and yeah.
So do you think the number one thing that people can do to fix their all health conditions is to fix their thyroid?
Well, first they should take iodine, right? And eat a high-fat carnivore diet, because it's not just why is your thyroid not functioning properly? It needs iodine, it needs zinc, it needs iron, it needs all these nutrients that we get on a carnivore diet. So I'd start there, because very simply, it could just be you're eating oatmeal, drinking oat milk in your, Starbucks, whatever, and you're preventing, or you're drinking tea and you're preventing the absorption of iodine.
Absolutely. Okay, next one is hair and eyebrow thinning, creating thyroid issues.
Yes, that is basically the nutrition doesn't get to the top of your head, because in a low thyroid state, you'll have, you know, things that keep you alive. Your hair doesn't keep you alive. Your nails don't keep you alive. Your eyebrows don't keep you alive. But these organs keep you alive. So the small amount of thyroid hormone is just going there.
Ah, I understand. You don't have enough thyroid hormone, and so then it's not going to your hair and your nails and your skin because that's not what's keeping you alive. What's keeping you alive is your essential organs. Got it. That makes sense. Okay, feeling cold or hot all the time.
Yeah, metabolism. So hot all the time would be, geez, adrenal. Hot flashes are always adrenal, but you can have this weird situation of uh, the thyroid is over and underproducing. So you can be hot one day, cold the next. It regulates body temperature. So your temperature is very important. And you can also just be hot because you have stress. So your stress response, which is what hot flashes are, will cause a vasomotor reaction and you'll be hot. So the problem is that thyroid function, hypothyroidism is it's like they knew a lot 50 years ago and then they threw it all out and all they kept was overweight, cold, eyes popping out. That's all they kept. They kept a few because when you're going through, you're seeing 50 patients at whatever health insurance you're seeing. That's how it is in Italy. GP sees all these patients and doesn't even take their blood pressure, look at their look at their tongue, do anything to them, and they just basically have crib notes on everything, and they come to a very quick conclusion, which is usually, here, take this pill.
Mm-hmm. Okay, so the next one is dry, flaky, itchy skin.
Yeah, again with the nutrition, not getting to your skin. Who cares about your skin? You want to keep your heart going and your liver going.
So that is very, very similar to the hair and the eyebrow thinning, is that the thyroid hormone is trying to keep you alive and not trying to help you with the other things like skin, hair, and nails. Is that the same as puffy face and eyes?
Well, Rena, so the problem is with this, you can have somebody who has none of those symptoms, flaky skin, hair falling out, brain fog, but they'll have 10 other symptoms that nobody associates with thyroid function, because basically your thyroid uses a sympathetic nervous system, besides the nutrition part of not getting to your top of your head, to communicate. So it could be anything. And I've had people that I've treated who didn't have their hair falling out. And then all of a sudden we started treating them, but they had depression, they had, suicidal ideation, but their hair was fine. And then we started treating it and boom, that all got better, but then their hair started to fall out temporarily because there's so much work. The healing takes a long time, but also you have a body that is a physiology that is downregulated. So basically, all these lights are switched off. It's like you have a mall with 100 stores and only 2 have the lights on. If you turn all those lights on at once, there'll be a fuse blown, right? So you have to go very slowly to sort of walk backwards and turn everything on in a gentle way.
Okay, let's talk about some other signs and symptoms, which you already mentioned: the bulging eyes, dry eyes, or double vision. That is a sign of thyroid impairment.
Well, you could also just have vision issues because you have hyaluronic acid, goopy crap behind your eyes, just like people go deaf if they're hypothyroid because their inner ear gets the goopy hyaluronic acid stuck in it. And I keep saying hyaluronic acid because I don't like it that people are injecting it.
That's so funny. Okay, changes in bowel movement, so diarrhea, constipation.
Yes, absolutely. Hyper and hypo functioning thyroid.
Okay, last one, which is a common symptom, obviously the goiter. So you mentioned that earlier. Can you explain what that is and what that looks like on the body?
Well, you can have an inflamed thyroid and not know it. You can have a small enlarged thyroid and not know. I mean, you can have a thyroid that is a bit enlarged and not know it. But goiter obviously is associated with this big lump, but usually it's caught by that time. Usually the doctor will say, you've got a big bump on your thyroid. The problem is they're taught to palpate. We're taught to palpate the thyroid, right? But the thyroid can have nodules on it, which you often can't palpate. So you can have the thyroid grow extra pieces when it's looking for more iodine. So it either gets big, the whole thyroid gets big, the follicular tissue that's two lobes, right? That will then just become inflated with blood, engorged. But you can also have, this and that. Extra pieces grow because it's trying to get bigger to trap more iodine from the bloodstream. So you can have goiter of the thyroid, and I call fibrocystic breasts, fibroids and cysts in the ovaries and uterus. I call those goiters of those tissues because for the same reason, getting bigger, anomalous growth in order to get more iodine. Those tissues need a ton of iodine.
Okay, I want to talk about the connection between, because that's interesting that you said that. Let's first talk about the connection between cholesterol and the thyroid. So many people, they're trying to do low fat diets or they're trying to lower their cholesterol. Why is that bad for thyroid?
It's bad because you're not eating any fat, which means your adrenals aren't getting any way to make hormones. Remember, the thyroid works very closely with the adrenals. So no fat, no cholesterol, no stress response, no way to address inflammation. That's basically why.
And every single hormone is produced by cholesterol.
No, only steroid hormones are produced. Thyroid is a peptide, so it's a protein-based hormone. But everything works together in the body. So, as I said, the adrenals work closely with thyroid function. So if you don't have any fat, there isn't going to be any adrenal participation and thyroid function.
Okay. And when it comes to young adults or adolescents, is that why so many women are having reproductive issues?
Absolutely.
Because of their cholesterol, lowering cholesterol, not getting enough iodine, and eating crap.
Yeah, lowering cholesterol. You can't make estrogen and progesterone and any of these supposed sex hormones. They're sex steroids. They're not even that. They do a whole bunch of other stuff that's not involved with reproductive function. And so they will have an irregular production of those hormones. So if you look at the hormone cascade, you have cholesterol at the top, and all this cholesterol is supposed to be, every molecule is supposed to be altered and will turn into, all the way at the end of the cascade, estrogen. But along the way, it has to jump through all these hoops, and every hoop is regulated by thyroid hormone.
That's why you need cholesterol and you need enough LDL and everything in the body, and you need fat to regulate thyroid. I want to talk about things that affect the thyroid because these are common things that I think people eat every single day. The first one, broccoli. What are your thoughts about broccoli?
Well, it's brassica, so it's like the farmer with his rabbits with goiter. It will prevent the absorption of iodine, hence cause thyroid issues.
So broccoli and cauliflower and cabbage and kale, they're part of the goitrogenic family of foods. Can you explain what does that mean, goitrogenic foods?
Prevents the absorption of iodine, causing goiter. But so are flax seeds, so are, soy, so are yams, so is oatmeal, it's unending. No meat. Meat doesn't do it. Fat animal products don't do it, but so many plants do it.
You mentioned that animal products don't do it well. Dairy is an animal product. And you mentioned the devil in milk or the devil in dairy.
There's a book called The Devil in Milk. That's why I say that, by an Australian researcher.
So why is it that an animal product like cheese or milk can affect the thyroid?
Because it's inflammatory, just like gluten can affect the thyroid. So the point is that the thyroid is this big ball of blood it's the adrenals are basically as tough as the bottom of your shoes, but the thyroid is this very delicate, spongy thing, which is very, very much affected by inflammation, way before your adrenal tissue per se. So these foods prevent the absorption of iodine, and that can be inflammatory in so many ways.
So would you not ever eat cheese and not have dairy?
Well, cheese, we are the only animal that eats another animal's milk, right? So if you can get cheese made out of breast milk, go ahead. But you can't. So if you have an issue, usually I say my program is, let's see what's causing the issue. You can get away. I mean, as I say all the time, I'll eat an ice cream once a month, maybe. I'll have, I don't know, we're going to Paris. I might have a piece of cheese. Probably not. I'll have a croissant more likely, but they're both. I don't have any issues. I don't have any health issues. I don't have thyroid inflammation. I don't have. So once in a while, if your immune system is not damaged, if it is not producing, if it's not attacking you, once in a while it's okay. But if you do it every day, like our humankind has done since we started growing grain, right? That's when it becomes an issue.
Absolutely. I love the fact that you are a little bit flexible with your high fat carnivore lifestyle. 'Cause I think people think it's all or nothing. I want to talk about the different types of carnivore because how funny. Carnivore is so simple, but then it's like there's different types. Let's get back to the things that affect the thyroid. Tea. What are your thoughts about tea?
Did an article on that. Tea is bad because it is grown in fluoride-rich soil. So tea, I found this amazing paper, can't remember his name, but an Irish researcher who basically said, please, to his countrymen, please don't drink tea. Irish soil is so full of fluoride already. If you drink tea, it's causing fluorosis. So, fractured bones, forget hypothyroidism, fractured bones, learning disabilities, all these things that are caused by fluoride preventing the absorption of iodine. I mean, it takes years to get fluoride out of your bones. They just suck up the fluoride. And fluoride is a halide, and iodine is a halide. So tea prevents the absorption of iodine, which we all need.
Is that all types of tea? Black tea, matcha tea, green tea?
All types of tea. They're all grown in the same soil. They're all grown in the same soil. And the research that I did, I mean, I lived in China. I used to love tea. But you can actually I documented congenital hypothyroidism is highest in tea growing areas of India and China.
Is that the same as coffee?
No, coffee does not prevent the absorption of iodine.
But for your thyroid, does coffee affect the thyroid?
Stimulants affect the thyroid, absolutely. Coffee is a stimulant.
My God, everybody has tea and coffee. That's going to be very controversial. Okay, let's move on to nuts because you don't like Brazil nuts.
No, because they're poisonous. So walnuts, I mean, you have a scale of nuts they're all evil. The least evil, I guess, would be macadamia because they have more cholesterol, wrong word, plant sterols, more sterols. Everybody eats them on a keto diet because they think, and just the plant sterol is not an antinutrient in this case, right? You could say that plant sterols are antinutrients because they are estrogenic. They are estrogen disruptors, I'm sorry. But, peanuts are legumes. They're not even nuts. All these things are so full of antinutrients, which will cause inflammation, which will cause eventually a thyroid issue.
Including almonds, cashews, nut butters.
Almonds are the worst. That's the bottom of the list. The top is macadamia and pecans, and the bottom of the list is almond, what everybody keto makes their cookies and cakes out of.
Hilarious. Okay. Fake sugars, artificial sugars. But I also want to ask you about monk fruit and stevia.
Not a fan.
But does that affect your thyroid?
Fake sugars will make your sympathetic nervous system think, sugar. It will remember. I remember sugar. Let's do this. Boom. Let's get stimulated. So it can be a stimulant. And monk fruit and stevia come from plants, and they are somewhat inflammatory to the gut.
How are they inflammatory to the gut?
Because they're plants.
Last few here, soy and oats. That's just rubbish, so don't have those. But many people take curcumin and turmeric. Same thing.
Oh my God. Yeah, all those, it has, flavonols and phytochemicals that are supposedly anti-inflammatory. No. Fat is anti-inflammatory. Animal fat is anti-inflammatory.
Not spices.
Not spices. Spices come from plants, obviously, right? So nutmeg is a stimulant, can make you crazy. Cinnamon is a stimulant. Vanilla is an opiate. Plants do all this kind of stuff. So pepper raises, sympathetic nervous system because it's a stimulant.
That's why carnivore is so great. Let's talk about the solutions, okay? First question for you. Can a low thyroid function be reversed or cured?
Absolutely. Unless you have this, okay. You can have, or if your thyroid has been nuked, no. If they've cut out half of it or a big piece of it, no. You're going to have to supplement with natural desiccated thyroid, not levothyroxine. You're going to have to give yourself adequate hormone. So I had a patient came to me with half a thyroid and nobody said anything. Nobody's like, you need thyroid hormone to function.
Okay, let's talk more about the hormones and why you shouldn't use levothyroxine a bit later. Let's talk about iodine because I think people want to know about iodine. Should every single person take iodine?
Yes. It's the halides and fluoride and PFAs are so pervasive today and what they eat. Yes, they are preventing the absorption of iodine. As I said, 150 years ago, not everybody needed iodine. Well, they needed it, but the sources were more, all cheese used to have one plus for cheese. They used to, use iodine to clean the cow's teats. So iodine would go into the cheese, but then they figured out that, bleach was cheaper, not cleaner, cheaper, and bleach is a halide. So no more, cheese is no longer a source of iodine.
Can we talk about the type of iodine?
Glucose solution is made out of both. It's made out of potassium iodide, and the potassium iodide makes the elemental iodine, which is what we need, soluble. So we can absorb it. So a lot of people are told not to take iodine. You're going to grow 3 heads if you take iodine, but take potassium iodide, which is not going to, it might give the thyroid a little bit of help, but it certainly won't help your breast tissue, help your uterine tissue, help your prostate tissue, help your ovarian tissue.
So which part of the Lugol's iodine helps with the tissues?
Both. You need both. You need Lugol's, invented, 200 years ago and pretty damn cheap and effective.
Okay, I think a lot of people are going to have that question because they don't know what to take. They just take something that is just iodine and then they don't know what's in it.
Lugol's. Has to say Lugol's. It's a recipe. It's like a solution that was invented by Jean Lugol. So you can't go wrong if it says Lugol's.
And how much should people take?
It depends. I would say, in the 80s, to reach sufficiency in a state that was already sufficient, you needed 2 drops. In the 80s. Today, with all this increased pollution and I'm thinking Italian inquinamento, possibility of consuming substances that prevent the absorption of iodine, I would say a minimum of 4 drops of 5% if you are already sufficient. If you're sufficient, we have to see, But I would say, I take 6. I take 6 every day.
Is that safe? It's totally safe to take, 4 drops, 6 drops?
Absolutely, it's safe. It depends. If your thyroid has 3 extra pieces attached to it, if it grew more, it'll it can overreact to the iodine because, there's so much fluoride parked in the iodine parking places, and you might have hyper symptoms. So you need to get that. You need to detox that stuff, the fluoride.
And what if somebody has active thyroid problems? So if they have like hypothyroid, Hashimoto's, Graves' disease is overactive. How much iodine should they take in that sense?
I don't know. There's no magic number because it's not just the thyroid. It's not just, there's also iodine is hugely necessary for the stress response. So the adrenals use it too. So you can't, there's no magic number.
So should they consult with you if they want to know how much?
Probably.
Okay, well, I'm going to leave a link for Dr. Bright in the Primal Labs, which is spelling out everything from this episode. So there'll be a link for you if they want to book with you. But you're probably overwhelmed with so many patients coming to see you.
That's why I'm right. That's why I kept saying I was going to write a book about thyroid function, and just seeing too many people. Thyroid function, hypothyroidism causes gallbladder issues. People come to me with 80% of all gallbladder issues are caused by hypothyroidism. They come to me with hysterectomy. So I basically decided that I can't write the book fast enough because it takes a long time to write a book. Because you have to make it nice. So, and it has to be edited and it has to be formatted. So I just put all my research on my website so people can access it because it's just terrible that people are suffering so much.
Absolutely. And again, the link for all that is going to be in the Primal Labs so everyone can see your articles.
Well, it's a subscription service. I want people to be able to go to the doctor with the references and say, this is why TSH is not a reliable measure for thyroid function. So I want them to have that information so they can advocate for themselves.
Absolutely. So going back to iodine, why is salt loading important?
Because it's a detox. It's a great detox for the halides. Because the iodine combined with the salt will push those halides out of the thyroid receptor parking places.
So if people want to do salt loading, how do you do that if you want to start iodine?
You have a half a teaspoon of salt in a glass of water, follow it with a regular glass of water, and you do that till you have to pee for a week.
Is that while taking iodine or before you start taking iodine?
I usually have people on a teeny tiny dose of iodine, yeah. You need the iodine because you have to push. It's the iodine combined with the salt that creates the detox.
Okay. I think a lot of people don't know that, and that's why maybe they might take iodine and not feel so great in a small proportion of people. Let's talk about fat to fix the thyroid. Why is fat so important?
Because it's an anti-inflammatory and it gives you adrenal function.
So when we talk about foods to eat, you like the carnivore diet, and you say that it depends on what type of carnivore diet you're doing. What is the type of carnivore diet that you do to heal hormones and fix the thyroid?
High-fat carnivore diet. So if you're eating so much protein that it doesn't turn into muscle tissue and enzymes, it's going to turn into glucose. Fat will never turn into glucose.
And how much protein is too much?
It really depends. I would say if you're ripping your muscle tissue by going to the gym and lifting heavy, you're going to need more protein than most people. But it depends on what you're trying to do. So if somebody comes to me on fire, I will give them more fat for a certain amount of time, and then they can add more protein. I just went paddleboarding this morning for an hour something, and I just had my decaf with butter and an egg yolk. And I did 6K, and the wind was, and I have felt great. So, if I had a big bite of fat before this interview, so I can be all cool, calm, and collected.
Have you had lunch though? Like you've had your ribeye?
Sure, it's 4. It was 4 when we started. Yeah, I had my steak with a big hunk of butter on it for lunch.
Okay, so it sounds like you eat a lot of butter and it sounds like you have a lot of ribeye, which I know because I ate with you in Italy. So I, I know this stuff, but just in case people there don't know. So I want to talk about the fat. In terms of ratios, I know that you don't love that question, but if somebody is healing, what is a ratio that you would recommend macros?
Well, I don't love the question because everybody's different. So women need more fat than men. I would say an inflamed female would need 80-20. I would say an inflamed male could get away with 75-25, 70-30.
Okay, so that is 80% of calories coming from fat, 20% of calories coming from protein. So let's talk about what that might look like if somebody wants to visualize that on a plate. You love this question, don't you, Dr. Bright? But I'm going to get this in the comments. So I just want to preempt it. What might that look like so people can visualize, oh, okay, this much meat, this much fat?
Okay, somebody who's 5'6", 5'7", 170 cm, something like that. It would look like a pound of beef and 4 ounces of butter, or 125 grams, 100 grams of butter. Stick of butter. This whole stick of butter thing got associated. It's like, so I said a pound of meat and a pound of, a stick of butter, because pretty much a stick of butter is 4 ounces, if I remember correctly. In the US, I haven't been there in a while. So all butter in Italy is 125 grams things, right? So there's fat in the meat. So you can't be eating sirloin. Well, you shouldn't be. I wouldn't recommend eating only sirloin steak because you're not going to get you're going to need more fat because your meat doesn't have enough fat. I always say fatty meat.
Do you get annoyed with the stick of butter thing?
No, it's okay. It's just that no, I don't. No, absolutely not. It's just that everybody's different. Everybody's tall. Everybody, I need more fat because I go paddleboarding and I see, many patients during the day, and my brain needs the fat. And I have 3 kids.
And that's important because if you have a higher stress lifestyle, you're more active, you have issues like whether that be thyroid or hormones, you need more fat. But it's good just to spell out for people so they have a baseline. And again, if they want more information, read your books.
But a 6-foot tall person, Rena, will need completely different numbers.
Let's talk about hormone replacement therapy. So, levothyroxine. So many people are on that, which is also called Synthroid. Why does that make things worse?
Because it's T4 only and it's synthetic. So your body, all those receptors that are needing thyroid hormone, they need T3. Your own thyroid, the human thyroid, makes mostly T4, T3, T2, T1, and calcitonin. And those poor people with no thyroids, nobody's addressing that, because calcitonin, along with the parathyroid glands, which have also been cut out if they take out your thyroid or they nuke your thyroid, regulate calcium levels. So bone tissue is very much affected by all these hormones, but there's 4 thyroid hormones. So levothyroxine and Synthroid is one, and it's synthetic. In a high stress world, what's the possibility that it's actually going to get into those parking spaces that the body has for something that is of an animal nature, that is homemade, that is not synthetic? Usually not likely. It will make the TSH go up and down, which is why they came up with it anyway. I mean, that's why they came up with TSH. That's why TSH became the be-all and end-all of thyroid measures, because a hypothyroid person with high TSH, the TSH would go down. But that doesn't mean they're not hypothyroid, because TSH is an unreliable measure.
We're going to talk more about testing thyroid. Okay, so if they don't use levothyroxine, they need a natural desiccated thyroid. What does that mean and what is that made from?
It's very importantly not made from cow thyroid, which you can get very easily. Cow thyroid is as bad as levothyroxine because it's a ton of T4. So they started in the 1800s. They would say, okay, ma'am, you need a half of sheep thyroid. Okay, you have these symptoms. You need a quarter of sheep thyroid. But they eventually isolated the actual, by freeze drying it, the quantity of hormone that was in. First they started with sheep, and then they figured out that pig production was almost exactly like human. So that's why we ended up with pig thyroid, and it, boom, immediately became a medication. Whereas cow thyroid is not a medication.
Is that the Armour?
Yes, Armour.
So is that okay to take, the Armour desiccated Okay, so that's good. That's good. So that mimics the human thyroid.
It is, yes, it is, yes, absolutely. The receptors say, wow, this is homemade.
Got it. Now, why is it not a good idea to take your thyroid meds on the day of testing your thyroid?
Because you'll be measuring the meds, you won't be measuring what your thyroid's able to produce.
So they should not take the meds on the day or before or
Well, the Synthroid doesn't matter because that's T4, it's inactive. T3 is active. T2 is active. T1 is active. T4 is inactive. It's like a protohormone. It's waiting to be turned into T3, T2, T1, which is done in peripheral tissues as needed throughout the day.
how do blood pressure medications affect the thyroid?
They prevent the conversion of T4 to T3. Well, they just interfere with it. So many things interfere with the conversion. Cannabis interferes with the conversion of T4 to T3.
Let's talk about testing the thyroid. Now, you mentioned many times TSH is not the entire story. Why not?
Because it's not a thyroid hormone. Because it's only there are three ways. Well, there are selenocysteines, which are enzymes which convert the T4 to T3, T2, T1, and there's three kinds. There's D1, D2, and D3. Certain tissues, the kidneys, the liver, are D2 tissues, and they will use TSH to say, I need more. The D1 tissues won't. D1 is brain. So, I hope I'm getting that right. But anyway, that is why you need to measure free T3 and free T4 because the TSH is not a reliable measure. It's not a thyroid hormone, it's a pituitary hormone.
So, you mentioned that only half the tissues use TSH to communicate with the whole body. Is that correct?
Few tissues. Yeah, I said half, but we don't know exactly. But we know that not all tissues use TSH to tell the thyroid we need more, specifically the brain.
So, if somebody wants to go to their doctor and ask for tests, what would be just the basic ones to test your thyroid?
Free T3, free T4. If you have inflammation, you definitely want to do the antibodies
And that is the thyroid peroxidase antibodies.
and antiglobulin, antithyroglobulin.
Last question for you, fasting. People don't they like fasting because they want to lose weight.
They like fasting because they're high on cortisol, just like they love marathons and they love CrossFit. They're high on cortisol. So cortisol is inflammatory, but it also produces endorphins, which makes you feel good for a little bit for a certain amount of time. So you can be and saunas and ice baths. These things will exaggerate. That will affect your stress response. So fasting will cause your cortisol levels to be high for a certain amount of time. Over time, the body doesn't like high cortisol because it's inflammatory, just like cortisone shots are inflammatory because they raise cortisol levels. When I was in school, we were taught to barely touch people who have a history of taking cortisone shots because their bones would just fracture.
So if somebody has pain or inflammation and they have a cortisone shot, that's not a good idea.
No, go on a high-fat carnivore diet. Remove stimulants. Absolutely not. Cortisone shots are horrible. So anyway, fasting raises cortisol. Eventually, the brain will say, oh my God, this person's on fire. I'm just going to turn off the production of cortisol. And then you have low cortisol, which causes autoimmune issues.
So then I think people might be thinking, well, how should I eat? What is a pattern of eating that, for example, you would eat or you would tell your patients to eat?
A high fat in the morning, some protein. I just have protein, a steak for lunch with butter on it and a steak for dinner. If I make my own beef jerky with a lot of fat on it, and my butcher just doesn't trim it. So it has this wonderful globs of dehydrated fat. Tallow bars. It's pretty simple. My husband eats chicken and pork. I don't really like it. Not because I just don't. I've heard my patients say they feel more nourished on steak. I feel more nourished on steak. It doesn't have to be grass fed. I use beef ribs because they're really fatty. So that's how. And as you said before, it doesn't have to be 100% all the time. It's while you're healing. And then you can You will be strong enough to eat some crap. But don't ever delude yourself into thinking that that's nutrition. That the other, as humans, the animal fat and the animal protein is our nutrition. That's how we evolved our brains. And
Well, Dr. Bright, thank you so much for this absolutely comprehensive solution to fix our thyroid. Sounds like it's fat, and more fat, plus some iodine. You wrote 2 books, Good Fat is Good for Women, Good Fat is Good for Girls. Can you explain what people will get from reading those 2 books?
well, the first book is about what uh, what propaganda menopause is. Menopause is not propaganda. Menopause is a wonderful thing. Women live longer and are vibrant because of menopause, so they stop having children at 50, 52 because unlike chimps who don't have menopause, they die because they basically have kids until they die. So menopause is a good thing, and it addresses every single symptom associated with menopause and the other fictitious perimenopause, and it gives you a solution. It explains why you might be having the hot flashes, et cetera, et cetera. It basically addresses adrenal function more. The second book, Good Fat is Good for Girls, addresses iodine and thyroid and how important both of those are for puberty and the rest of your life, because how your puberty turns out basically sets you up for the rest of your life.
Wonderful. Well, Dr. Bright, thank you so much. All the links for everything is going to be in the Primal Lab so people can just pick and choose and see everything that you have available. Thank you so much again. And I'm sure we're going to see you very, very soon.
Okay. Nice to see you.
Thank you for joining me today on this episode with Dr. Elizabeth Bright. If you would like to learn more about the thyroid, how to fix the thyroid, foods to avoid, as Dr. Bright mentions, and exactly what to eat, you can go to the Primal Labs. Basically, there is a link in the description of this video. You click on that and open it, and all the information is going to be there. Now, if you're learning from and enjoying these free episodes, please hit the subscribe button because that's an excellent zero-cost way to support this free health podcast. Now, you can also find me on other social media accounts. I'm on Instagram and on Twitter, as I generally share different information to what you'll see here on YouTube. The name for all the social medias is the Primal Podcast. And if you love this episode, you'll also love another episode I did with Dr. Annette Bosworth. She talks about the #1 way to fix insulin resistance and why it starts with a ketogenic diet and ketones. She'll talk about the 10 common symptoms that you need to know and why you should try a butter-only day. Finally, thank you for your interest in root cause healing, and I'll see you next week.